All right, guys. Well, thanks for joining us. Thanks to Medelita for hosting this panel discussion for Nurse Practitioner Week 2018. As we know, nurses comprise the largest sector of the healthcare field, and now nurse practitioners are also getting a lot of light shed on the profession. I'm always seeing it as a top 5, top 10 career choice to go into. Not only that, you know, the impact that we stand to make, especially with provider shortages throughout the country. I'm in the Southeast, you know, I'm in Georgia. We have some of the greatest provider shortages in the entire country in this area alone. And I'm sure you guys probably can speak to that in your areas as well. So just a lot of opportunity for nurse practitioners to really get in there and make a change in our communities and provide high quality care. So I'm Julia. I'm an Atlanta-based family nurse practitioner. I currently work in functional medicine, and I'm really passionate about health promotion and disease prevention.
I'm Christine. I am a doctor in nursing practice, got my family nurse practitioner education at Rush University in Chicago. I still need to take my boards, but I am currently teaching as a professor at Cal State Fullerton, and I'm working in the emergency department at Kaiser Permanente in Orange County.
I'm Monica. I'm a family nurse practitioner in Washington, D.C. I work in women's health, so I'm in an obstetrics and gynecology office in D.C. at Georgetown University Hospital. Prior to becoming a nurse practitioner, I was a labor and delivery nurse, where I fell in love with women's health, and working outpatient now has gotten me a chance to kind of do more of the education side of women's health, which I love. I am passionate about maternal health and maternal morbidity and mortality, and I literally love being an NP.
I'm Fatima. I'm actually a nurse practitioner student, so I'm in the family nurse practitioner program. I'm currently 1 semester away from graduation, so I'll be finished in May. I'm currently in a pediatric rotation, which I'm loving, and I work as a registered nurse right now in community health, which I love as well.
I'm Dr. Kevin Brunacini, rather newly minted DNP graduate. I'm a family nurse practitioner, and I have my own nutritional counseling private practice located in northern Kentucky, focusing on sustainable weight loss. Taken from the AAMP, American Association of Nurse Practitioners. Nurse practitioners are clinicians with a master's or doctoral degree and have advanced clinical training beyond their initial professional registered nurse preparation. So there's didactic and clinical preparation, and it focuses on specialized knowledge and clinical competency to practice in primary care, acute care, long-term healthcare settings, for example. We can work autonomously and or in collaboration with other healthcare professionals to provide individual and group care.
And so I think it's just the, like, I guess the borders and the different state laws, because you go to one state and nurse practitioners, you know, may have full authority. Like, for example, I know Monica, you're in DC and you have full practice authority. And then you go to other states, like, for example, Julia and myself, we're more in the South, so we're a little bit more restricted. So I think a lot of people can kind of get confused in that way, because, you know, you go to one state and nurse practitioners can do everything. They can start up their own practice and do everything. And then you go somewhere else and you're a little bit more restricted. You need like physician supervision. So I think just overall, it can get, like you said, just some gray areas, because there's a lot of differences throughout the country with our role.
Right. No, I think that was perfect. I think scope, you know, or the lack thereof, definitely creates a lot of gray area. Georgia was the last state to give nurse practitioners prescriptive authority. So, you know, I totally feel that we are behind, you know, everything when it comes to what we can do. Another thing is that our nursing board is governed by a medical board. And I'm sure, you know, we all talked about that in school, and how really nurses should be governing their own boards. But, you know, still pretty early in the fight. So we'll see. I think we're making headway, though, each and every day.
So I think the process of becoming a nurse practitioner is a lot having to do with time management and removing that bedside care to now being more involved with the patient's plan of care and being that person that they're going to follow up with, being very careful with your diagnostics that you order, what you determine that they are diagnosed with, Medi-Cal, Medicare, and follow-up, and then also health promotion. So that portion of that process and learning, I think, is different from being an RN. And I think also knowing that you're part of a statistic of, because for me personally, knowing that I still need to take my board, I don't only represent nurses, but I also represent nurse practitioner students. I represent the university I went to, the passing rate, and then also where do you after, like the letters I get, where are you working now? Are you gonna go into education and be a professor? Are you gonna go into family practice? Are you gonna go into the community, like you're doing functional medicine? You're and Fatima, you have all these opportunities to decide. I think you're doing pediatrics, I think, and then same. So I think there's just so much opportunity that it can get overwhelming.
Say when you're becoming a nurse practitioner, if you were a registered nurse first, or perhaps you're practicing as a registered nurse while you're in school, I think one of the most difficult aspects of that kind of nuance is changing roles from taking orders and carrying them out to doing the assessment, the diagnosing, and the plan. And I noticed with my nurse practitioner students that I preset now, which is basically students who, follow me in clinic and learn from me, it is that diagnosing and that plan creation, because as a nurse, you might know what to do, but ultimately you're waiting for the physician to say, hey, let's go ahead and hang the magnesium. As a nurse practitioner, you're saying, hey, let's go ahead and hang the magnesium. So I will say that while in school, and I see NP students, one of the most difficult aspects is creating that plan. And anything with time and experience, it gets better and better. But I will say that stepping into the new role from registered nurse to NP can be a little bit difficult.
For me, because, I feel one of the major roles of the nurse practitioner is to educate through health promotion and disease prevention. I'm really passionate about that. So, even after I finished school, even though I was unsure, I really wanted to go into aesthetics because my background was Heme Luke and wanted to do something on the lighter side. Just found myself exploring all these options and felt like, well, if nothing else, I can make some health videos. People will keep their phones in their hands. How can I really reach the masses, so to speak? And so for me, I found myself on social media trying to make some healthcare videos and let people ask me questions, which was a little different than community outreach that you learn in the book. But I think we've all seen now, having presence on the social platforms, you are able to still have an impact. And who knows? I mean, we know that the future and technology all will play a very big role in how we, care for our patients. So we'll see.
That's how you and I connected, Julia. And I'll kind of piggyback off. With my role, there's a lot of inherent education, that's what primary care is at its core, is or preventive education. So not only do I enjoy that and kind of do that inherently with what I focus on in my practice, but a big driver for my DNP pursuit was to be a better educator and how to be an advocate within the community, because we really we don't do well with weight loss, clearly, or obesity management. So how can I be a better educator to the masses? And being a nurse practitioner in of itself, despite a master's or DNP background, just being an NP embodies integrity, credibility, excellence. And that's, I think that's what sums up nurse practitioner for me in terms of its impact in the healthcare system. Is we demonstrate that very well, and the public recognizes that every year.
I think some of the biggest supporting research for nurse practitioners has been that we provide the same high quality care that doctors do. How do you guys feel about that? Do you feel that it'll be a challenge that you or currently face, or one that you continue to face in practice? Or do you think that the culture is more welcoming to the role of the nurse practitioner?
I can take this one. You know, working in Washington, D.C., I will say the community is pretty welcoming of nurse practitioners. They've heard of us. They have NPs that they love. They've received great care, and they've heard stories from friends and family who also have an NP that they prefer. So I will say that I do think that we're moving in that direction here in Washington, D.C., and in our surrounding states, Maryland and Northern Virginia. But I'll say many of the physicians I practice with actually come to me as a patient. Many of the physicians in my hospital come to me as a patient. And it's not to say that, you know, I'm better or someone's worse. It might just be that they prefer to go to a nurse practitioner so that they're not going to their direct colleague. So it could be that. But it also could be that nurse practitioners, being nurses first, we're used to listening. You know, we really care about the entire patient head to toe. So even if I'm just there to do your pap smear or, you know, your gynecologic exam, I'm going to ask how you're doing. How are your kids? Is there anything that's stressing you out? Are you still feeling safe at home? Things like that, that kind of touch on how the person's doing. You know, often patients will come to their healthcare visit not for physical pain or an actual ailment, but just because something's kind of like off. And I think that as nurses first, we kind of catch that nuance and we're able to kind of care for the whole patient. So I do think that, and obviously I'm biased, I do think that NPs, we have a very special place in healthcare. I think that people are noticing that. And as we continue to provide excellence in the care that we provide, as we continue to advocate for ourselves, whether it be professionally and how we are being compensated and how we're being respected with how we're called or our name, et cetera, or if it's us doing continuing education, going to conferences, you know, perfecting our skills, I think that we will become or be seen as leaders in healthcare. I really do. I think that some people get confused because we do have the word nurse in our name, and that's not a bad thing. It's just a real thing. So, you know, they say, oh, well, I saw the nurse. When am I going to see the doctor? And I'm like, I'm your girl. You know, you're just seeing me today. So I think that education helps. But I will say that I as the physicians respect us, as we respect ourselves, the patients will respect us. We give great care every single time. I think that we'll see the NP profession take off, as it already is.
Yeah, so I agree with Monica. I think everything she said was pretty on point. But there are still a lot of gray areas with the MD and the mid-levels and the MPs and PAs and all that stuff. And I do notice it as a student sometimes, you know, when I'm in rotations, you know, sometimes you can tell, like, you know, the MDs kind of want to maybe run the MPs, or, you know, they have to like ask questions and, you know, they have to kind of have the last say. And like I said, I am in a state where it's a little bit more restrictive authority and practice. So that's maybe where the changes are. But I do agree with the whole, you know, her saying that, you know, we do have a special place in healthcare, because I think it is noticeable. And like she said, you know, we may be biased because we are nurse practitioners and we have been nurses first, but I feel like I can definitely tell, you know, a nurse's heart. And I feel like we're just the best of both worlds. Like we're providing care, we're, you know, prescribing, we're diagnosing, we have that whole science and expertise, but we just still have that caring heart. And so I think that we are, I don't know, I just think, you know, we're moving in the right direction. So that's the good thing.
Fatima, could you maybe describe briefly the difference between, you know, the different roles that one can take? You know, I know you're a student right now. You said you're doing FNP, but what are the other roles that you can do at the master's level with nursing?
So there are a lot of different roles. So of course, you know, you have the FNP program, which the reason why I chose that is because it's widely marketable. And I feel like that can kind of take me in multiple directions. So if I want to do pediatrics, I can choose that. If I want to, you know, be like Monica and do women's health, I still have that option. If I want to do adults, I can do that. It was just the degree that I chose because of that reason. It's very flexible, and that was just the choice that I wanted. I wanted to be able to still work in the clinic environment, and if I wanted to, I could still be in the hospital. So it just gave me a lot of options. But within the master's level, you can choose a specialty if you'd like, if you know that you're passionate about something, if you know that, you know, for example, maybe psych is like in your heart, you were a psych nurse and that's what you want to do, then you can pick a program, you know, to just specialize in psychiatry. We have pediatrics, neonatal, women's health, adult gerontology, and you guys can like add on to the list. I know there are a lot of specialty programs, so it's amazing that we have all these options for us, you know, to advance our degrees as nurses. So it's really great that there's all these things for us out here.
I just wanted to add that I think as advanced practice nurses, we get to be really innovative, and we get to give to the community in a different way because our credibility has to do with our bedside experience. And then, like you all were saying, taking on that new role of diagnosing and planning the care. And it's just fun. And I think that we are different. And I tell my students that all the time, that you're just going to love your job. And you say that nursing is hard now, but you get your RN and you're going to want your master's, and then you're going to be feeding your NP, and then you're going to be feeding your doctorate. It seems impossible during the process, but once you get it, you're like, I just want more, because the doctors are embracing us and the community is seeing our presence. And it's, you know, state by state, they're slowly giving us more authority to do what it is that we need to do, because there's also that generation of baby boomers that are wanting to retire and wanting to hand over their businesses to nurses that are credible, they've worked with, and now we have our advanced practice. And so overall, I think that the innovation that we get to contribute to the community is one of the most fascinating things about going through becoming an NP.
Right. And so I heard you kind of talk about that that eagerness, you know, a lot of times to go from an RN to MP and DNP, which I think raises a really good question, guys. You know, for me, before I even finished undergrad, I knew that I wanted to be a nurse practitioner. I love the idea of having the autonomy. And as nurses, I think we all have gotten the question, why not med school? But to me, it was just the best of both worlds. I could go and still, you know, have a lot of autonomy without all of the student loans and the time commitment. But I think the bigger picture at hand is, you know, and I think I've seen a lot in the community, a lot of discussion about this, with that, not necessarily race, but that interest in going back to school. Where does that leave our patients at the bedside? Me, I'm no longer there. I do work PRN, and I really miss it because I'm passionate about that patient interaction. But really, you know, I'm seeing lots of nurses, you know, a lot of them, unfortunately, aren't even interested in bedside to any degree. You know, they just kind of are viewing it as a stepping stone to their master's or their DNP, that type of thing. And so I think it really poses a threat to the patient population, because while there's all this knowledge, you know, we know that we need more nurses to, you know, offset the shortages. We need nurses at the bedside, especially if we're ever to get a universal healthcare system that demands more nurses. What do we do?
I will say that when people feel valued, they generally stick around. And this is not to say for the nurse that knows they want to pursue their nurse practitioner degree, or they know they want to go into management. Another master's path that I was going to add on to Fatima's list was like the clinical nurse educator. There's just so many different things we can do as within the nursing profession. But I will say there are a lot of people who love the bedside. I actually loved labor and delivery. I mean, loved it. I loved my 312s. I loved the intimacy with my patients. I loved it. But really, I saw myself in the outpatient arena and in the community doing a lot more education, which is what a lot of people needed prior to getting to the unit to deliver their baby. But I will say that valuing our nurses, I think, is really important. I'm talking about compensation. I'm talking about money to go to conferences, for, you know, continuing education, perks, making sure nurses aren't burnt out, making sure that we have safe patient, nurse to patient ratios, making sure that nurses are so supported that if they do want to stay at the bedside, they can. They're not broke down. They're not burnt out. They're not, you know, turning gray and haggard. Third year of nursing saying, I have to get out of here. What do I do? And just thinking, oh, I guess I'll go back to school. You know, I want going back to school to be something that you're passionate about because you want to be in an advanced practice position, not because you're burnt out in your current position. So I do think it's really important, if we're going to keep nurses at the bedside, that we that these organizations and the state boards, that we find a way to support them, financially, emotionally. And then if they do want to go back to school, that there are programs to help them through school so that perhaps they can give back to that organization again as a nurse practitioner or a clinical nurse educator or something like that.
Right. So I think that's a great point. The Institute of Medicine's report for the future of nursing really pushes for hospitals and, educational institutions to really have seamless tracks for, nurses to go back and advance their career. So while I think those things are in place, like you said, there's still, lots of other issues like burnout and reasons, that would make other options more attractive.
Shadow a nurse practitioner. If you're not sure, shadow a nurse practitioner, shadow 2 or 3 or 4, if you're on the fence, because I think it's important to, not fantasize about what the profession is, because it's a lot of work. NP school's hard, it's quick, it's rigorous, it's a lot of work. Many of us worked while in school and maybe shaved off 5 years of our life doing that. But I would say shadow someone, because I think shadowing an NP and getting the real and the raw from them will help you to make that decision for yourself. Obviously school is time management and, studying and all that. But I think before you actually make that commitment, you should be sure. And I think one way to help with that is to have a few shadow days.
I think I see a positive future for the role. I think it's like I mentioned earlier, it's moving in the right direction. I think as we grow as a profession and continue to advocate for our roles and continue to advocate for ourselves, I think that the public, they're being receptive to it, and I think they're being very open to the role of nurse practitioners. And I think people are seeing what we do, and they're trusting us, they're believing us, and more people are wanting to go into this, because we want to be leaders. We want to be providers, and we still want to have that compassionate care. And so I definitely see a positive future for our role. So I'm excited to see where the role is going to take us, and what new avenues is going to open up for us. And some of us on here on the screen that are entrepreneurs and just opening up new things. Julia, you with your Nurse Link events and just getting people together, that's really what I see in the future. Just a lot of group effort, and it's going in the right direction.
Turning back to innovation, I think that with nurse practitioners or advanced nursing practice, the word leadership pops into my mind, because I think that we're very open to taking on that role on social media. We're open to new technology. We have a background in rigorous education system that we went through, so we know how it feels. We're a credible source of information for people who don't know, like you were saying, they need a shadow, a nurse practitioner if they want to be that in the future. We're open to communities. We can be leaders in the hospital setting. We can be leaders in the community setting. We can be leaders in medicine. I think it's changing. Our patients are a lot smarter. Technology is advanced, right? They can look things up. So they have the option, do I Google this, or do I go to my nurse practitioner or physician just for extra information? And because we've done the bedside and done our assessments along with the physicians and developed a rapport, I really think that we have an optimistic forefront for being leaders in health promotion and innovation, being creative, healing, really, is what I really, really believe.
I was going to say in the next 5 to 10 years, kind of bouncing off of what Christine just said, with the innovation, I see us at the forefront of telemedicine, just really kind of booming in that space, because there's so many people who need healthcare who might not be able to get it. So I do see us increasing access to care in that way. I also see us on the front lines, advocating for people who can't advocate for themselves. So maybe even within politics and, getting on the Hill and advocating for changes in healthcare and changes with how we get access to care and patient, health promotion and prevention of disease. So I kind of see us leading in some other arenas other than in the hospital and, in the outpatient setting, but really kind of that political space and in technology. Yeah.
Again, happy Nurse Practitioner Week. I know you guys will be doing some cool things on your pages, so I'm just looking forward to all the excitement.